You're watching CommonWell TV. We're in Orlando, Florida for HIMSS 2017. It is Scott Adams here with you, along with Arien Malec, as we've got a couple questions for some of our partners, one of which here with RelayHealth. Now, this one fairly specific for us, Arien. CommonWell member Brightree has recently built their fire-based services into their latest product platform. So can you speak of the significance of that and how it impacts other CommonWell members?
So this is incredibly exciting. Interoperability has been defined around a set of legacy standards that are fairly inflexible, but we're all moving towards an API model based on HL7 Fire. And what Brightree and other partners are doing is revitalizing CommonWell around that comprehensive API platform that gives a lot more flexibility for interoperability in this country.
Now, you mentioned API, so CommonWell also has announced it's building that API to go ahead and complement its existing core services. So how will that improve nationwide data exchange?
So interoperability, as I said, has been very specific, but what we're doing with CommonWell around an API platform is looking at a common set of core APIs and then the ability to have value-added services that serve on top of that. So as an example, things like ADT notification services and counter notification services have been proven to improve transitions of care, but they're kind of hardwired into hospital workflows. By building them on top of the CommonWell API, we can enable a broader ecosystem of those notification providers serving the nation as opposed to serving one particular setting of care.
So one of the cool things, CommonWell provides its members access to a nationwide network of both patient ID and matching services.
That's
Is that
right.
correct? Okay, if you could expound a little bit onto that.
Absolutely. So if you think about the experience in walking into a healthcare setting, sometimes we wander in the emergency department at 3 a.m. and we're a little tired. We don't exactly know what's going on. And many of us have had multiple encounters in the US healthcare system because we've got, for example, a complex health condition. Do we always remember where we've received care? Are we in a mental state where we can walk the clinician through that? And is that busy ED doc in a position to be able to look up all of those settings of care one by one? What the nation needs is the ability to have one place to go look at the variety of settings of care where I've received care, find out where those have been, and then request data from all of those settings of care in one workflow. And that's really what CommonWell provides. It's a much better way of providing higher quality care for patients across this country.
And finally, Arien, a new administration and some unpredictability with that. What are the biggest concerns when it comes to the HIT industry?
With the new administration, there's been a lot of potential churn around the exact mechanics of healthcare payments. But the broad trajectory, the drive towards value-based care and value-based payment, the drive towards more efficiency in the US healthcare system, these are things that are true independent of administration. We should all remember that bills like MACRA and 21st Century Cures, passed with broad bipartisan support, these actually don't drive the roadmap for healthcare innovation in this country. And these are things that don't rely on a change of administration. I just came out of a session with McClellan and Andy Slavitt, former CMS administrators under a Republican and Democratic administration, and they agree that the direction that we're going requires more information technology driving more healthcare outcomes in support of value-based care objectives, and that's really the direction that we're going in, and the direction that CommonWell is proud to support.
A wealth of information, Arien Malec, and for more on RelayHealth, you can log on to RelayHealth.com, one of our proud partners of CommonWell. Be sure to go ahead and log on to CommonWellAlliance.org also for more information. Thanks so much, Arien.
Thank you.